find all our previous community of practice on the ARC website that I guess in time, maybe Rena, you could add the link in, or somebody later on. So for each one, we put the recording of the presentation and a summary of some of the things that were discussed. So a very warm welcome to you all in joining the community of practice. My name is Elspeth Matthew at the University of Hertfordshire, and I lead the Inclusive Involvement in Research theme here at the ARC, the NIHR Applied Research Collaboration East of England. And Sally Burrows and Rena Masrani are also part of the Inclusive Involvement in Research theme, as is Laura, who is also on the call, but on my other screen as well. And I notice a number of researchers who are involved in collaborating with the ARC. We very much want to make this a collaborative space. And the idea of this was not to necessarily present about the research, but to talk about some of the challenges, some of the things that we learned, some of the sharing, some of the difficulties, and some of the success stories for when doing inclusive involvement in research with diverse groups, underserved groups, as the NIHR calls it, or issues around co-production, which Sarah's going to share with us today. So I would like to hand over to Sarah now, who is going to tell us a little bit about the MIND study and reflections about co-production. And I've known Sarah for many years in the previous iteration of the ARC when it was the clerk. And it's fantastic to see the work that Sarah has done over the past years, who now co-leading this really important study with lived experience, and also really reflective practice about sort of what, when we hear everybody's doing co-production, but really to think about some of those issues, difficulties, changing things that happen over time. So the session is going to be an hour and a quarter. We've usually finished about 2:15. I know some people have to leave early. That's absolutely fine. Just dip in and out. And if you want to turn your cameras off, that's fine as well. And Sarah's going to present for about 20 minutes, and then we'll have the rest of the time for questions and comments. We had thought about breaking into two groups, but as we all want Sarah in the same group, I think we'll just try and have those discussions with the whole group, but we'll have to see how it's worked because it is slightly bigger this time. So do make full use of the chat as well for comments. So I'll hand over to Sarah now. Thank you very much.
Thanks, Elspeth. And just want to say hello, warm welcome. My name is Sarah Rae, and I am someone with extensive lived experience, let's put it that way. Today, I'm planning to share my experience of co-leading the MIND study and involving people with lived experience in the research. Probably wondering why I've chosen a sort of jigsaw image, but I think it's nice and bright and cheerful, but also I think co-production is very complex and multifactorial, and that kind of, with all the bits, sort of the moving parts and the bits, I kind of think that's quite a good representation. But in fact, I am actually sceptical that authentic co-production can be achieved. I'm going to put that out there to start with. However, I am involved in another project where steps have been taken to ensure that people with lived experience have greater autonomy in the decision-making to facilitate more equal partnership working. But I'm going to talk about that later. So MINDS was conceived from my lived experience of a distressing transition from an inpatient mental health ward, after 8 months on that ward, in fact, and hearing from friends then who'd been discharged from acute care settings. It became really apparent to me that many other people had poor experiences. It wasn't just me. So, this was anecdotal evidence. But when the MIND charity published their large, hard-hitting Leaving Hospital survey, it really catalysed me into action. So just to say, the MIND study, it aims to improve discharge planning and outcomes for adults transitioning from inpatient settings to the community by understanding discharge planning needs for all key stakeholders as a complex intervention within a complex system. If I could have the next slide, please. So I wanted to share this slide not because I want to give you a sort of deep understanding of the mind study methodology, but because it's a complex project, and this gives you some idea of the sort of complexity of it. And it can be more difficult, I think, when the project is very complex or highly technical to work in a co-productive space. So just to say very quickly here, we had first stage one was a realist review synthesis. The second year we worked with healthcare engineers using a systems approach to understand the impact of wider contexts on discharge planning and to co-design solutions. And then the resulting interventions were implemented on 6 wards across 3 mental health trusts. And during work package 3, and we're actually in work package 3 now, completing the process evaluation. So could I have the next slide, please? Can I have the next slide? Or
has that not come up? Embedding lived experience.
That's it, perfect.
Yeah, okay. Just a little delay, sorry.
So as I said earlier, the project was conceived from my lived experience, and I co-lead this project with Karina Hackman from Norfolk and Suffolk Foundation Trust. We have a lived experience advisory group, or a league, that includes 12 people with and without research with and without research experience, and generally they meet 4 times a year, although we do have ad hoc meetings in between. We have 2 members of the league that sit on the study steering committee, and one is co-chair, and each work package is co-led by a researcher with lived experience of discharge. So I was really determined, that the voice of lived experience would be baked in at every level, and we would work co-productively with people with lived expertise from start to finish. So this was the sort of structure that was, this is how we sort of structured the project. But I think, as all things, I've learned an enormous amount about what facilitates and what inhibits co-production in this study, and it's not always a walk in the park. So if I could have the next slide, please. This is working in a co-productive space with the league. So and these are just a few of the ways I want to emphasize this, that the league has heavily influenced and shaped the research in each work package, and it's taken from many, many examples that were captured in the impact log by the team researchers. So in work package 1, the league completed a pilot interview to test out our topic guide, help prioritise the topics for our topic guide. They reviewed our ethics application, patient information sheets, and consent form for work package 1. And individual league members also joined the researchers in analysis meetings. And when I say individual, I don't mean one, I mean a small group of league members rather than always being the whole league. In work package 2, they collaborated with the team, influencing the structure and content of the co-design workshops, and including going the extra mile and even attending our sort of dummy practice run, which was great. The group were actively involved in co-producing the onwards approach, interventions, and especially the discharge planner. And then in work package 3, the league contributed in multiple ways, including to the participants' patient information sheet, consent forms, refinement, and the finalisation of the onwards approach. And they also had imaginative ideas about how the study findings could be disseminated more widely. And it was the league who suggested amendments to the evaluation questionnaires as well. So, I mean, and that is just a very sort of high-level flavour of their involvement that I've just picked out to share with you today. We did try, if I could have the next slide, please. So we did try to evaluate and understand how well co-production was working by circulating a co-production survey. It was co-produced with the League, and we didn't do this initially. This was from February 2024, that after every League meeting, the members received an invitation to complete this survey anonymously. And the next few slides, I am not going to stop and talk at length on those, but I will just flick through them so that you can see that the results are all, you know, the findings are all very positive. So, you know, if you look, you can see. Did people get a chance to see that? But basically, they're all at the positive end of all the questions that we were asking. That, as I say, had been co-designed by the League. Really helped us very much with developing that survey. I think you'll get a flavour of that. Okay, so on to my learning and reflections. So as I said earlier, I'm going to be the first to admit that my ideas about what constitutes co-production have shifted during the mind study. Now, that's through evolving learning while research has been undertaken, but also my involvement in other projects. So if I was starting out from scratch again, these are some of the things that I might want to do differently. So I think, firstly, I would have made, and this is particularly me, I would have made more effort to have obtained funding for meaningful pre-grant involvement, because we were limited to consultation work. We had £300 from the Research Design Service and perhaps a dozen or so ARC vouchers to pay people to share their views and their perspectives. But I would double my efforts now to see how to find more funding for that stage of the work, because I think it's so important. We did have lived experience researchers, obviously, who were helping with that work, but still patient and public voice really important. I would have given more consideration to inclusivity and diversity when recruiting team members. So I really feel perhaps on my side that was a bit of an omission, a bit of a blind spot for me, but I have now reached out and been in contact with Black Thrive, with Global Black Thrive, because if we were ever doing anything in future, I would think that that would be a really important factor to consider going forward. If we were ever devising another research project or following on from this one. Consider how League members, especially those with no research experience, could better understand a complex project at the outset. I think that's a real challenge. Facilitate the early building of trusting relationships among League members. So I think it would have been nice perhaps if we set up some random coffee mornings, and even in one project, a couple of projects I've been involved in, there have been WhatsApp chats which have worked quite well. I agree there's all sorts of potential risks to a WhatsApp chat and whether it's monitored and all that sort of thing, but I think it can actually increase the sort of connectivity among the group, especially they're meeting quarterly. And there may be other ways. Those are just a couple of ideas. I mean, I think it's just something to think about, really. It's about building relationships, not only with the research team, but between League members. And regularly review, this is what I'd want to do, is regularly review a co-designed and co-produced impact log that would have included the League and the researchers' perspectives on impact. Because I think you need to have both, because what is impactful is an impact for a researcher might not be the same as for a member of the League or someone with lived experience. Could I have the next slide, please? So I think greater clarity around the purpose and the values of co-production at the start of the project would have been helpful. probably we did work hard on a ways of working document initially, but regularly reviewing it to ensure that it was still fit for purpose, I think would have been a good idea. I would also like to think, so we've started after requests from the League to produce a project newsletter that's shared with the League, but I think that would have been really nice if that could have been co-produced with the League. But as I say, they requested the information, but I would have seen that that's something that where there was a real opportunity for co-production and blogs and things. And also the survey that we just sort of saw the highlights of, I think, you know, ideally that would have been co-designed from the League, and we would have started the survey from the get-go. But this is what I'm saying about all these things are sort of reflections that I've learned about through my involvement in the study. It's not something I realised at the start. Can I have the next slide, please? So I think finding more creative ways to promote equal partnership working, such as our sort of deep dive. I said we had ad hoc meetings, and we did what we called sort of deep dive working, where a few League members would join researchers, say, in analysis meetings or reviewing ethics applications, because whole group involvement in every activity. I mean, we had a very enthusiastic League, and they had a lot to say, and it just turned out to be enormously time consuming. You know, we'd get through half of what we really wanted to cover in a meeting, because I mean, that was great that they were so talkative and enthusiastic, but it wasn't a very I suppose it wasn't such an efficient way of doing things. I would like to have upskilled those academics with little or no knowledge of co-production values, because not all the members of the wider team were familiar with ways of working, sort of equal partnership working. I would like to have invited League members to co-present at events, but we're now thinking about that when we disseminate. And also have the League to be invited to join the monthly wider team meetings, and a greater focus on building capabilities within the League. Now I realise all those, I can see, you know, all those are influenced to some extent by budgetary constraints, and it really does require thinking outside the box to think how you can do some of this within what we all know is inadequate PPI funding, usually. So reflecting, next slide, please. So reflecting on my co-leadership role, what would have helped is to have more opportunities to develop my understanding of research methodology as a non-academic with entry-level research knowledge, independent supervision and mentoring. I did suggest at the beginning, which we have monthly reflective team practice. That's been embedded, been very insightful, especially in the early days. But I would have really liked to have had dedicated reflective practice sessions with my co-lead, which I think would have helped us to work in tandem better. And to say that was John Wilson in the first half of the study. Greater clarity regarding roles and responsibilities at the start would have been also another thing I think where I would have benefited. Could I have the next slide now? So Alison Faulkner, who many of you I'm sure will be familiar with, a lived experience researcher, is conducting an independent evaluation of the PPI in mines. So the findings from a variety of activities will be collated into a report to share this learning about co-production in our study, both internally and externally. So there have been interviews with League members, academics and co-leads, written responses to a questionnaire, in-person PPI co-production day. We just had that recently, and it was attended by many of those in the wider team and several of the League members. And if I could have the next slide, please.
Sorry for this delay.
That's all right. That's nice and bright and cheerful after all my plain, very plain slides. But this image was produced at the co-production in-person day by a graphic artist, and she was busy capturing the conversations. And I just think probably this is something we could talk about in a lot more detail, but I just wanted to show it because I'm sure if you just spend a couple of seconds looking at it, a lot of the comments that people made, etc., will resonate with you. And if I could have the next slide, please. So I want to caveat this and say that this is a snapshot of some of the early findings from that in-person day that've been highlighted, that were highlighted in the first draft. But I've selected some of them. So you know, what I'm saying is take it with a pinch of salt, basically. But you know, they are what was said in the first draft. But it is only a first draft, and the report is still yet to be written. So the co-production positives included this is what the group on that day were discussing, and it was sort of agreed. They felt that coming together on a journey, a feeling of empowerment, love, working with like-minded people, passionate, your voice being heard, having equal value was all important, and they felt that that's what their experience had been in the mind study. They also reflected that co-production had changed throughout the study and was different in different work packages. And work package 2 felt to be closer to the concept of co-production. It was felt more time could have been taken at the start of the project to establish a shared vision and the co-production approach. And the League was felt to be less involved overall than other elements of the project, such as the leadership and lived experience researcher involvement, and was positioned by some participants at the information level of co-production, of the co-production ladder. If I could have the next slide, please. So this is the recommendations that came out of the day, which is build in support for everyone from the start, appreciate each other's expertise. And co-production is about bringing people together with many different experiences and types of expertise. It was also felt that the NIHR should build in the infrastructure and governance to support PPI in more practical ways that ensure researchers and to ensure that researchers are rewarded for doing PPI. To keep reviewing co-production throughout the project, don't leave it until the end. We did try to evaluate the PPI earlier on, but we didn't have the funding at the beginning of the project. And ensure or build a shared vision from the start. So that's really my sort of reflections on minds. I'm very, very quickly just going to talk about another project that, and unless you think I should leave this to another day, I'm just aware of the time. It's up to people. I don't know what people in the room feel. I can quickly talk about another model where I think people with lived experience are involved in a way that's slightly closer to is a more sort of closer to co-production, even though I think that's still an unachievable aim at the moment. I don't know if people want to carry on and hear a bit about how the ways of working in the ImmunoMind project are different, or if you'd rather stop and just discuss the mind study. Does anybody have a view on that? I can't see from where I am what the views are.
I'd love to hear more.
No one's
Sarah,
saying anything at the moment.
Okay, right. Okay, ImmunoMind. This is the project I wanted to talk about earlier. So it's a highly technical UKRI funded project in which the way people with lived experience are involved. As I said, it seems to me a step closer to co-production, although by no means, 100% co-production. So the ImmunoMind Hub is one of 6 mental health platform hubs. Now I put the link into the mental health platform because you might be interested in looking at that if you're not familiar with it, because it's a national platform. And it aims to find the causal pathways by which immune and metabolic factors lead to severe mental illness as a basis for new personalised therapeutics that are precisely matched to patients most likely to benefit. And as you'll see from this next slide, the nature of the research is really highly technical. Yeah. So it's quite difficult to see how you can have co-production in this sort of, in a research project like this, but we do have 3 that highlighted in green were 3 what are called therapeutic co-led lived experience projects. And these were identified by people involved in the bid development as being important to those people living with serious mental illness. Because in the group that was working as the bid developed, we all said, you know, where you can't have co-production, you know, people can't be co-producing Mendelian genetics and things. So we've got our own projects that we're working on, and they're co-led with an academic and 2 people from the co-production. Each has 2 co-leads of the co-production council. So I think the next slide pretty much I've just, oh yeah, Immunomind, yeah. So the next slide, could I have that? Yeah. So members of the co-production council manage a oh wait a minute, Immunomind co-production council. I think we might have skipped. Oh, that's all right, because I did say what I was going to say on the slide before. Sorry about this. Members of the co-production council manage a budget of nearly £2,500, so £250,000. No, £250,000. Get it right. Spread over 5 years. Now, I have a slightly larger time allocation as the chair, but otherwise, everyone has the same number of hours allocated, and we are all paid the same hourly rate. I don't like being chair. I don't like the fact that it introduces an element of hierarchy, but someone has to lead and sort of cobble agendas together and do things like that. The responsibility of the co-production council is to work in equal partnership with scientists and researchers to co-produce 3 co-led therapeutic personalisation projects with the dedicated teams, bring diverse experiences and expertise to the programme, ensure the programme's outcomes are relevant and useful to patients and the public by rigorously examining and/or challenging research outputs for the benefit of patients, efficiently manage the PPI budget, ensure information is updated, accessible and tailored to the needs of the patient. So I think the thing I really want to focus on now is the next slide, which is the co-production council budget allocation. So being responsible for managing our own budget gives the council greater decision-making powers than traditional advisory groups have. So as I say, we have that nearly £2,500 to decide how we want to spend. But we were still gifted this financial autonomy. For example, we have decided to spend a large proportion of the funding, £40,000, on evaluating co-production processes within the council and in the co-led projects. So that's our decision, because that's, as I say, a priority for us. And the funding is also has to be divided. We have to weigh up everything, like how many in-person meetings we want a year, because that's very costly, etc., etc. And basically, the funding is divided to cover all those different activities. And it really just illustrates that the number of budget items that we're sort of juggling and trying to weigh up, you know, is this more of a priority or is that more of a priority? You know, we've even had to plan for the fact that the NIHR might increase the hourly payment rate for people involved in research. So we've really had to think about a lot and develop the budget for the plan for the 5 years. So I just wanted to give you a flavour of Immunomind. It's really not done it any justice, but it's just a different model where you have autonomy over the budget, which is a kind of, I feel, just increases decision-making powers for those people with lived experience. So I've suggested some questions, but they are literally just suggestions. You know, how you involve experts by experience with little or no research in highly complex or technical research, which I know is of key interest to Wellcome. Do you believe authentic co-production can be achieved in research? And if not, what are the biggest barriers? Would you or do you co-produce research with people with lived experience? If yes, how would you or are you promoting equal partnership working? So they're just a few ideas that I have, but I can imagine that there'll be plenty of other thoughts on the subject.